If you are a parent of an autistic child, there is a very good chance that someone has handed you a lot of information about what is wrong with your kid, what they can't do, what they struggle with, what deficits they have, what interventions they need, what milestones they haven't hit, what the future might look like if things don't improve. And I would like to offer you something different today. Your child is not broken. Now, hear me out. That doesn't mean parenting them isn't hard. It doesn't mean they don't struggle. It doesn't mean your life isn't sometimes overwhelming in ways that are genuinely difficult to describe to the people who haven't lived it. Trust me, I know. What it means is this: your child's brain works differently from what we've been conditioned to think of as normal. And different is not the same as broken. Your child has a disability. So do mine. So do I. I'm not going to soften that or talk around that. But somewhere along the way, our culture turned the word disability into a dirty word, into something shameful, into something that means less than. And I want to push back on that hard, because disability can and does mean difference. And difference, even when it is hard, even when it requires more support, even when it looks nothing like you expected it to, does not have to mean bad, at least not all the time. What if the most important shift you could make as a parent wasn't a new strategy or a new intervention? What if it was simply deciding to see your child differently? Hi, my name is Dr. Colleen Sarah, and I'm an AuDHD psychologist and mom who combines research and lived experience to help you see, support, and celebrate every kind of mind. And today we are talking about what your autistic child actually needs from you. So before I go any further, I want to be really honest about something. My clinical work, as well as my lived experience as an autistic person and a parent to autistic children, are primarily with people who are level 1 and level 2. The examples I draw from, the things that feel most familiar to me, come from that part of the spectrum. I am not going to pretend that the full range of autistic experience looks the same across support levels, because it doesn't, obviously. The daily reality for a family supporting a child with higher support needs looks fundamentally different than mine. I know that. And I don't want anything I say to flatten that reality or make anyone feel invisible, when what I'm trying to do is the opposite. What I can tell you is that the core principles I'm sharing today apply broadly, but you know your child. Hold what I say through the lens of your specific kid and your specific reality. You are the expert on them, not me. I'm just here to offer a different way of looking at them. Here's the reframe I want to offer you today, and I would love for us to sit with it, even if it's uncomfortable. Your child and mine, their behavior is communication. All of it. The meltdowns, the shutdowns, the refusal, the rigidity, the thing they do that you've never been able to fully explain to someone who hasn't seen it. None of it is random. None of it is your child trying to make your life harder. All of it is your child trying to tell you something about what they are experiencing with the only tools they have available to them in that moment. A child who melts down at the grocery store is not a bad kid. They are a kid whose nervous system hits a limit and had no other way to say so. A child who refuses to get dressed in the morning is not being defiant for just the sake of it. They may be dealing with sensory input that feels genuinely painful, or a transition their brain wasn't ready for, or even anxiety about the day ahead that they don't have words for. What changes when you start from that place, from a place of curiosity, when instead of asking what is wrong with my child, you ask what is my child trying to tell me? Everything changes, because curiosity leads somewhere. Judgment tends to just lead to more of an emotional distance between you and your kiddo. Now, I want to name something here that is more complicated, because I think you deserve honesty and not just reassurance. A lot of parents of autistic kids are what I would call constant intervention mode. Therapy appointments, assessments, school meetings, strategies, programs. And a lot of that support is genuinely helpful and necessary. I am not saying don't get your child support. But what I would like to invite you into is some honesty about what's driving those choices, because the answer is rarely simple, and it deserves more than a simple framework. Sometimes the question underneath an intervention is, am I trying to help my child thrive as who they are? And sometimes it is, am I trying to make them look more typical, more manageable, more acceptable to a world that wasn't built for them? Most parents, if they're being honest, will find it some of both. And here's what I want you to know. That does not make you a bad parent. It makes you a parent who is navigating a genuinely impossible set of trade-offs. Because here's the part that doesn't fit neatly into any framework. For some kids, in some bodies, in some communities, the calculus is not just about authenticity. It's about safety. The world is not a neutral place. It does not receive all children the same way. And a parent who makes a painful, complicated intervention decision because the alternative, not doing anything, puts their child at real risk, is not failing their child. They are loving them in the most honest way they know how in a world as it actually is, not as the world should be. So rather than a clean test of good intervention versus bad intervention, I want to offer you this instead. Take some time to get really honest with yourself about what is driving your intervention choices. Sometimes that honesty will surface something worth examining. And sometimes it will confirm that you are doing the hard, loving, complicated thing that your specific child in their specific life actually needs. This is also where I want to say something specifically to parents of children with higher support needs, because I don't want you to feel like I'm ignoring your reality. Your child, even if they are nonverbal, even if they need support with every basic daily task, even if their world looks nothing like the autism you see represented in the media, is a full human being with an inner life. They are in the room when you talk about them. They absorb the emotional tone of what is being said, even when they can't respond to it. They know whether the people around them believe in them. That doesn't make the hard parts less hard. Changing your child's diaper, who is beyond what we've been told is a diaper changing age, is hard. Navigating a system that was not built for your child is hard. The grief and the exhaustion are real, and none of that changes the fact that your child deserves to be spoken about with dignity, even when you think they aren't listening or don't understand, especially then. Which brings me to something that does not get enough space in these conversations: grief. If you are a parent of an autistic child, you may be carrying an enormous amount of grief. Grief for the life that you imagined, grief for the milestones that didn't happen the way you expected or at all, grief for the relationship with your child that you thought you'd have, grief for the parts of your own life that have changed beyond recognition. That grief is real. It is legitimate, and I am not going to tell you that you shouldn't feel it. What I am going to tell you is that unfelt grief doesn't go away. Most of us have been conditioned to not feel our feelings. We push them down, we rationalize them, we stay busy enough that they can't catch up with us, we think. We redirect them into frustration or control or withdrawal. We do almost anything except actually feel them. But feelings that get pushed down don't disappear, unfortunately. They come out sideways. And when you are a parent, sideways often means it comes out onto your child. The grief that hasn't been felt becomes the tone in your voice that says more than you meant to say. It becomes the exhaustion that leaks into how you describe your child to other people. It becomes the distance your child feels even when you are physically present. So what do you do with it? You feel it somewhere safe and away from your child. You let yourself sob. You journal. You call a friend who can help you hold it. You work with a therapist. You find a support group for parents who get it. You give yourself permission to be a human being who is struggling in a space that is yours so that you can come back to your child with more of yourself available. The goal isn't to get rid of grief. The goal is to build a relationship with it so it stops running the show from underground. I want to shift now because I think you need something to hold on to after all of that, because there was a lot. Your autistic child loves you. They may not show it in the ways that you expected, or they might. They may not show it in the ways the parenting books described, or they might. But they are showing it regardless. And part of raising an autistic child well is learning how to see their love. Here are some of the ways that some autistic people express love and connection. These are not universal. Every autistic person is different, obviously, but they come up enough that I want to name them. Info dumping is one. This is when your child launches into an extended, enthusiastic download about something they love. The deep dive into dinosaurs at 7 a.m., the 15-minute explanation of a video game mechanic. When an autistic person info dumps with you, they are inviting you into something that they care about deeply. They're trusting you with what lights them up, and that is intimacy. Pebbling. This is when your child brings you things, a rock they found outside, a drawing, a funny video, a weird fact they came across. They're offering you the things that matter to them, and that is love. Proximity. Some autistic people don't seek physical touch the way that neurotypical people do, but they seek closeness. They want to be in the same room. They want you to do their thing near you while they do their thing. That parallel presence is connection. The third eye press. Some autistic people show deep affection by pressing their forehead against someone else's that they love. It's a form of closeness that bypasses the social performance that can feel overwhelming. When your child does this, they are telling you that they love you. Your job is not to teach your child to show love in ways that are more recognizable to you. Your job is to learn their language. So what does it look like to love an autistic child in a way that they can actually feel and receive? Receive the info dump. When your child launches into their thing, stay. Put your phone down. Make sounds that let them know that you are with them. Ask a question. Let them teach you something. You don't have to share the interest. You just have to share this moment and be invested in this human. Spend time without an agenda. Not time structured around teaching, correcting, practicing, or preparing, just time. Side by side, doing something they enjoy or nothing in particular. Your child needs to experience you wanting to be with them, not just wanting to fix them. Follow their sensory lead. Notice what they seek out and what they avoid. What helps them settle? Design their environment around what they actually need, not what you think they should need. A child who is not in sensory overload is a child who is available for connection. Protect their right to say no, to hugs that they don't want, to social situations they aren't ready for, to being touched by relatives who haven't asked. When you protect their bodily autonomy, you tell them that their experience of the world is valid and that they have the right to take up space in it, exactly as they are. And then here's the simplest one. Talk about your child with dignity, even when you think they aren't listening. Assume they always are. I want to close with something that has been on my mind throughout this entire series. There is a lot of division in the autism community between autistic adults and parents of autistic children, between people with lower support needs and families supporting people with higher support needs, between people who see autism as identity and they're proud of it, and people who experience it primarily as disability who might feel shame, between people who have had very different lives shaped by the very different versions of the same diagnosis. I am not interested in competing over whose experiences is harder or whose perspective is the only valid one. What I am interested in is the fact that we need each other. Autistic adults who share their experience are offering parents a window into what their child might not yet be able to say. Parents who show up every day for their children are doing something that deserves to be honored, not dismissed. These groups have more in common than the loudest voices online would have you believe. And at the center of it all is a child or an adult who was once a child, who needed someone to see them as fully human and worth loving. This is what this is all about. So if you are wondering whether your child is autistic, or if you are an adult who's been listening to this series and recognizing yourself, my practice, Sierra Center for Behavioral Health, offers virtual diagnostic assessments at accessible price points. The link is in the description below. And if you are looking for a community where autistic adults and parents of autistic children can learn together and actually support one another, That is exactly why I created the Healing Haven. It is an online membership grounded in accurate, identity-affirming neurodivergence, education, support, and solidarity. The link is in the description as well. This is week 4 and the final video in our Autism Awareness Month series. If you missed any of the earlier ones, they are all on my channel. Thank you for being here and for caring enough about your kid to watch something like this. It matters more than you know.